Hello, my name is Dr. Robert Fromm, and I'm the Chief Medical Officer at Maricopa Integrated Health System. Today, we're talking about the new legislation, the Affordable Care Act, and specifically we're going to talk a bit about the insurance elements that come into it because of the Affordable Care Act. We're fortunate to have Dr. Betsy Thompson with us. She is the Chief Medical Officer for Region 9 for CMS, very knowledgeable in this area, and we have an opportunity to pick her brain, if you will. Betsy, thanks for being with us.
Oh, I'm happy to be here. Thank you.
What services will be available under the programs that are offered through the insurance exchange?
The coverage on the health on the marketplace has to cover 10 essential health benefits. This was something that was required by the Affordable Care Act in statute, that we had to determine essential health benefits. And what we decided to go with after much consultation with states and other stakeholders is that there would be a state benchmark plan that would be used to determine what would be covered under each of those benefit categories. So the 10 categories, I'm not going to recite them all, but it's things like hospital services, medical services, maternity and newborn care, pharmacy. Those are the sorts of benefits that every plan has to cover across the country, every qualified health plan. But in Arizona, what precise services under each of those benefit categories was determined by a benchmark plan chosen by Arizona, and that is the state employees plan that they currently have, and is a pretty generous. It's a pretty generous benefit.
And I understand that actually under the insurance exchange there will be alternative plans that may offer different services, but they all have to have the essentials.
That's correct. They all have to offer the essential health benefits as defined by your benchmark plan here, but they can sweeten the pot, so to speak, and they could add additional services to that, as you've seen with some plans, for example, with Medicare Advantage.
Mm-hmm. Preventive services, are they going to be available under this?
Not only are they going to be available, but they're going to be covered without any copays. So this is a big piece of the Affordable Care Act. We're only talking today really about the marketplace, as you alluded to earlier. There are many other provisions in the Affordable Care Act that go a very long ways to help people access services and to help afford those services, particularly preventive services. So already, individuals with Medicare no longer have copays or any out-of-pocket expenses. They don't have to meet their deductibles for a host of preventive services. And similarly, in most commercial plans, that's also the case. It will be the case for all of the plans in the health insurance marketplace, that there are no copays, no deductible applied for the most cost-effective preventive services.